It always startles me. Don't record. So
Yes.
yeah, kick us off, Kayla.
Okay.
This is her group.
Yes. So I'm Kayla. So I kind of lead all of our fertility related support groups here. We have 4 currently. There is fertility talks geared at people in the fertility journey at any point, but mostly we have people who've been struggling with infertility for a while. Childless, not by choice, just to kind of meet the demographic of people who may not be trying any longer, but are still dealing with the grief of not having children. And then we have pregnancy and infant loss. And then our newest one, pregnancy, which we've kind of it's like pregnancy and parenting after loss, to meet that demographic of parents. And yeah, just our heart and goal is just to bring people together in the community who are suffering in these different ways and going through these challenges, because all of it can feel so isolating because it's such a unique aspect of our lives. And when you don't have other people around you who have experienced it, it does. It feels very isolating and you feel unseen and unknown. And so we've been able to experience that firsthand and seeing the community come together and people feel seen and known in the process. So we're very excited to have you and hear about what you have to say.
Yeah, I'm so happy to be here to be able to share my story, and hopefully it can touch someone or heal someone, or someone can relate to it, or feel something just a little bit more positive than we've been feeling. And if not, sometimes the weight is so heavy, it's good to know that other people are also here to help you bear it. So that is my intention for today. So I'm going to be telling my story, which is pretty heavy. But I know a lot of you relate to it, unfortunately. And then fortunately, because that's what this group is for, right? It's to bond, and it's to have a shoulder to cry on and a hand to hold and people to walk next to you, not in front of you or behind you, doing this journey, which can be a very long journey, as it was for me. So mine lasted 4 years, and it started in 2018. I had a positive pregnancy test. I wasn't necessarily trying to get pregnant. I wasn't not trying to get pregnant, if you know what I mean. So, but happy nonetheless. I was a nurse at the time at Grady in critical care. And so a lot of ripping and running around trying to save lives. And I was surprised when I had a positive pregnancy test. I also was bleeding, so it was definitely a surprise because I thought I was on my period, and it just wouldn't go away. So I went to the OB and I did a transvaginal ultrasound, and the OB told me that I was miscarrying. So my first pregnancy, which I already didn't know how to feel, ended in a miscarriage. So a lot of emotions there that I had to process. At first, I was just like, okay, well, I guess, I don't really know too much about it. I'm a nurse, and I know how to save your life, but I don't know how to bring life into the world. I'm not a maternal health nurse by any means. So my OB told me that this is a normal part of the pregnancy journey, and I'll go on to have a healthy pregnancy to not even worry about it. So I'm like, oh, okay, this must be common. So he was so nonchalant about it. I just was like, oh, okay, cool. So when I'm actually like trying and ready, I'll just have a baby. So fast forward to 2020, it's COVID-19. I'm sorry to add that trauma to the story, but it's COVID-19, and we are, well, I am in New York now. I did a travel assignment. I went to help out in the front lines. I was working at Emory, but I said, if I'm going to do it, I'm going to really help and go to New York, which is the epicenter at the time. As we remember, it was really bad.
Wow.
And I got sick, ended my travel assignment early, barely made it, like barely stayed alive, but did nevertheless. And then I was able to come home once I tested negative. And after about a month or so of counseling and everything from that very horrific experience, I started working in the OR, which is way more lax than the critical care unit at Grady, as you can imagine. A lot more sitting down, and I was pregnant. I took a pregnancy test at work because I just felt pregnant. I don't know. And then I had some bleeding again, but this time I didn't go to the OB. I went to the ER. And the ER doc did a transvaginal ultrasound, and he's like, "You're having twins." Again, didn't know how to feel because who is raising twins? What do you mean twins? Like, like inside of me, what is going on? How did that even happen? But I'm like, okay. He said, follow up with your OB, just to make sure everything is okay. For now, you look fine. Like the babies are fine. You still have some bleeding that could just be like a implantation bleeding. So I followed up with the OB, and by the time, like maybe 3 or 4 days later, my bleeding got worse. I had 10 out of 10 abdominal pain and cramping. I just felt horrible. I was really sick. And I'm telling the OB, like, something's wrong, something's wrong. And she's like, well, I'm doing an ultrasound. We're doing a regular testing. Everything's fine. You can go home, just get some rest. And I'm like, something's like wrong. I go to the ER, they're doing an ultrasound, everything's fine. They keep sending me home. At 13 weeks and 3 days, I lost my first baby. I'm like, okay. I knew something was wrong, and I kind of felt a guilt. Like I should have fought harder. I should have did more research. I should have done something. Like I had some guilt, but I still was pregnant, and my symptoms had subsided at that point. So I'm like, okay, I'm still pregnant. One baby, I can do this. I feel better. So I went to the OB, and they verified that I lost the first baby. And she said, everything looks great. You're good to go. You can go home. You can go back to work. And I felt comfortable enough for my friends to throw me a gender reveal, virtual, of course. We're in 2020. The morning of the gender reveal, I woke up and I just called my friend. I said, this is a bad day. And she's like, what's going on? And I was like, I don't know. It's just a bad day. I can't tell you what's going on. I don't really have any symptoms. It's just a bad day. And about a few hours later, like right at the start of the gender reveal, I went to use the bathroom and the baby fell out. Mm-hmm. And again, that guilt kicked in. Like I should have went to the ER, but then I was like, what am I gonna say? Like the nurse in me was like, if I was a nurse, I'd be like, okay, why are you here? Like what would I say, like to make them do testing or something? Should I have lied or, you know? So I went to the ER because I had to deliver the placenta and everything else. And when I went to the ER, the doctor was like, what brought you in? And I said, well, I was 15 weeks pregnant and my baby came prematurely. And she said, how did you even know you were pregnant? As if I would make this up. Like I wanted to be in the ER in 2020. And like I would lie to say I was pregnant. And it was the same ER I had been to numerous times throughout that same pregnancy for pain and bleeding. And I said, did you want to see a picture of the baby? And she said, yeah. And she saw it and was like, oh, that's a baby. So then I had like this feeling of doubt in healthcare providers start to come in. And it just got worse. It just got worse. I'm like, oh my God, like, is this what patients are like going through? Like, is this what the rest of his pregnancy journey is like gonna be like? I've never treated a patient like this. Like, this is crazy. How can she question me? How did I know I was pregnant? Because I was pregnant. Like, yeah, I had a baby inside of me. I don't know how to answer that question. So, my doctor, I followed up with the OB and she diagnosed me with cervical insufficiency. So my cervix is too weak to carry a baby, and I would typically go into preterm labor at the end of first trimester, beginning of second trimester, when the baby becomes too heavy for my cervix to stay closed. So she said, in order to fix the uterus clodge, which is the suture and stitch around the cervix, which is at the end of the uterus, just to keep it closed, and you'll get it removed about 36, 37 weeks. She was referring to a transvaginal cerclage. She said, but you have to make it to 13 weeks. And I go back to work. I have more early miscarriages. More early miscarriages. And I'm never referred to a specialist. And I think it's important I keep mentioning I'm a nurse because even as a nurse, like I didn't know about all these doctors, about cervical sarcoidosis and insufficiency. This is all new to me. And I'm still having trouble navigating the healthcare system despite of my credentials. And I'm still getting treated the way I was treated, despite of everything that I knew and the knowledge I had. So it wasn't until my boss at the time was like, you need to see a reproductive endocrinologist and probably a geneticist to see if there's any genetic components to your losses. Um, and we can look for one for you. So my OB never even like suggested that, despite of having multiple losses. So at 5 losses, I finally saw a reproductive endocrinologist. He did a thorough like blood test on autoimmune diseases like thyroid issues, which are common factors when we consider miscarriages. Or some autoimmune diseases which could cause miscarriages. I was negative for all of those. And then on a day of a procedure she had scheduled to check the lining of my uterus, I took a pregnancy test and I was pregnant again. And I'm like, okay, so what do we do now? And she's like, well, I'm gonna follow you. She was like the first doctor that was like really, I felt really reassured, and I felt like we had a plan. And she gave me hope again. And I'm like, okay. So she put me on progesterone, which is a medicine to keep my cervix strong to hopefully make it to the cerclage at 13 weeks. And I did. 13 weeks, I made it to the maternal fetal medicine doctor, which is where I graduated to from the reproductive endocrinologist. And she put in the cerclage and she said, come back in 20 weeks. And I'm like, oh my God, that's a long time. It's like 7 weeks. Like, I don't think I could like last that long. Can I be seen sooner? And she's like, no, this won't fail. Like, I've never seen it fail. You'll be fine. And if you're not, you're going to have really bad pain and bleeding. Like, you'll know if something's wrong. I'm like, but I had 5 losses already. I don't really feel comfortable waiting to 20 weeks. I've never even made it to 20 weeks. I just feel comfortable being seen sooner, like at least 15 weeks or something. She's like, no, like she stonewalled me. Like, no, you're fine. Come 20 weeks, I feel great. I'm excited about my 3D ultrasound, which is like the rite of passage at that time. And mid ultrasound, the ultrasound tech leaves the room. And the doctor comes in and says, Mrs. Dumas, your cerclage fell.
Mm.
And I'm just shocked because I feel great. You know, I said, you told me there would be fireworks. Like, I would be in excruciating pain and there'd be bleeding. Like, there's nothing wrong with me. What are you talking about? It fell. She put up the ultrasound and pointed to different structures and said, see, it fell. And I said, well, can we do another one higher? Can I be on bed rest for the rest of the pregnancy? What, like, out of desperation? And I'm a very proud Leo type A person. I'm like, I don't date for nothing. And I was like, please, just anything. This is the longest I've been pregnant. We have to fight for this pregnancy. And she said, no, you can go and deliver your baby very casually.
Mm.
And I was back to a point where I lost faith in my healthcare providers. And the way she treated me, I was just like, in that moment, it put a stain on my whole pregnancy journey. And I would argue that's one of the worst moments I ever had. And we've already talked about some serious moments that I had, and the way she responded would be the worst in my opinion. So I left that office saying I'm going to fight. For 20 weeks is as long as I've been pregnant. My baby is healthy. So I'm looking up peer-reviewed articles to see what kind of treatment other doctors have done successfully for failed cerclages. I'm looking up doctors. I can call my village. I'm like, we have to find a doctor who can do a transabdominal cerclage, which is higher than the vaginal one. We have to fight for this pregnancy. So we found a doctor in Texas. I talked to his secretary. He called me at like 9 something at night and was like, I need you to fly here. He was known for doing high risk surgeries, had saved twin pregnancies with the same issue I had. I thought I only have one baby. Maybe, he could say, help me. He said, I need you to fly here. And I got on the last flight of the day, and I made it to Texas. And they rolled out the red carpet for me, honestly, from security to the intake to operating room, everything. But it's like he was new, like he was true to all of this. Like this is what he did. That 3 hour surgery took 8 hours because of the flight. My baby was coming down more. But it was successful. I woke up out of anesthesia. They were cheering. You're still pregnant. I'm so excited. I'm barely out of anesthesia. Like, am I pregnant? Please, am I pregnant? And by the time the anesthesia wore off, contractions started to set in because the surgery had took too long. And they gave me every type of medicine possible to try and prevent those contractions. Unfortunately, after 36 hours of labor, of hard labor, my water broke. I had to go back to the OR, get both of those cerclatus removed, and I delivered that baby on July the 17th. I'm sorry, July the 18th, 2021. And his ashes were placed in a garden that they have at the hospital. That's very beautiful and serene. They have like ceremonies there that I go to every year. He promised me if that was to happen that he would bring me back, no cost, and put in a transabdominal cerclage outside of pregnancy, and he stayed true to his word. And he said, you'll be a mom. And the crazy thing, I believed him. I really did. Despite of all those losses, I believed him. So that November of 21, I went back to Texas. Free of charge, he put the cerclage in. And May of 2022, I got a positive pregnancy test. I was followed by a reproductive endocrinologist here in Atlanta. I graduated to the maternal fetal medicine doctor, a different one. I was followed by my OB. And on December 30th, 2022 at 12:45 p.m. Eastern Standard Time, I gave birth to a 4-pound, 16-ounce baby boy who is now a pot-bellied 2-year-old toddler. And it's very weird to be a parent after all that, because those first days, before those first days, when I was rolling back to the operating room to do the C-section, I told the anesthesiologist after we talked about a lot of stuff, we both worked at Grady, I was like, if you told me I was giving birth to an alien, I would believe that before you tell me I had a baby in me. Like, I was in complete denial that I was having a baby. And then the fact that he went to the NICU after just furthered that denial, because I'm like, did I have a baby? I don't even see him. Like, I can't move my legs and arms for 12 hours, so I didn't see him for 12 hours. And I'm like, did it really happen? Like, I don't think I really had a baby. It definitely interrupted the bonding period for sure. Instead of us having a mother-baby relationship, it was more like a nurse and patient relationship. Like, granted, I care deeply for my patients, and it was no different for my son. But I didn't have that connection that everybody told me I would have. Like, when you see your baby, it's going to be, oh my God, an instant bond. It didn't happen for a month because I just anticipated that he would not be here. Like, he would leave. And I had to work through counseling and had to be intentional about believing that he would not leave. And, he's my baby and he would stay and things like that. But it definitely interrupted the bonding. And then it's just a very weird feeling to hold gratitude and grief at the same time. Because we're talking about 4 years, 8 miscarriages, 1 stillbirth, and then you finally have a baby. I'm grateful, but that whole 4 years of loss. And then that's not the only loss. I lost my mother during that time. Like I lost a lot of things during that time. It just was hard to navigate. So counseling became just such a big deal for me. I mean, did hypnotherapy to be able to carry on because I just felt like very stagnant in my grief and depression. And then once I had him, I was diagnosed with PTSD, reasonably so. So, um, but being on the other side, it doesn't necessarily get easier instantly because you have a baby. And I don't think that's talked about enough. It's a very dynamic feeling. You know, you're trying to celebrate my milestones and take care of a whole human being that you have now while still randomly crying and due dates pass of other babies and death anniversaries of babies pass and all the things you missed out on. You were try and go through pregnancy and losses and life is still happening. You know, you still have to go back to work on top of all of these things. So it's just a lot to carry. Just a lot to carry. I see you have a comment. Oh, she was saying she struggled bonding with her baby after stillbirth too. Yeah, 100% Cora. And I think that's normal. I really do. Like if you have a loss, it's just like you don't completely trust when you finally have a baby. You don't. Especially if you anticipated it for years or even 12, 9 months or 10 months. That's just a long time of anticipation of a baby. And it just doesn't come to fruition. So yeah.
Yeah, thank you for sharing that.
Yeah. Yeah. I know it was a lot to digest. Yeah. But I hope that it is my hope that we are able to continue to move on, like continue our journey even with the grief and learn how to cope with it more efficiently. Whether that's with talk therapy or medicine or whatever the case may be. However, I think one of the things that I don't do well, especially now that I have a baby and we prioritize our kids, is taking care of ourselves and our grief after a child comes into the equation. It's like you're innately, taking care of your baby and your child and that's a lot. That's a whole lot. And God forbid you're married. You have to take care of your other baby, which is your significant other. So it's a lot. It's a lot to run a whole household. But the grief doesn't leave. You still have to carry that. And hopefully you're able to take it off the shelf every now and then to address it so that the so that the load can be lighter. Cora, are you laughing at me because you understand the plight? Yeah, but hopefully we're able to do more self-care. I will argue like when you have losses before having a baby, that the self-care needs to be greater. Like it needs to be more intentional. It needs to be more prioritized because it can interfere with marriage and your relationship and things like that. That was another issue I had that it interfered with my marriage and that ended in divorce. So that was another layer of grief and issues that I had to navigate on top of all the losses, on top of them, being a mom and having a baby. So it's not easy, all that comes with loss. It's layers. It's layers. The other thing I didn't really realize until this year was how loss secondhand trauma for my friends. Like really caused a lot of trauma for them to the point that they second guess having kids or maybe not even want to have kids or like are hesitant about it. Which, what do you say to that? In my mind, I've had enough loss for everybody, so y'all should be fine. Like, just statistically speaking, like statistically speaking, I think like everybody else is going to have a smooth, journey. Out of the group, like it can't be everybody having issues, but um, it's just that's something else that you have to also navigate too. You're still a friend. You still have all these titles, your daughter, your friend, it impacts your relationship. Yes, absolutely. And like, how do you navigate somebody else's trauma related to the first-hand trauma that you had when you struggle to do that because you have all these other roles and, it's tough. It's really tough. It is really tough. So grace is our biggest friend in these moments, 100%. And I hope like we're surrounded with people who also gives us grace, and are friends to us when we're not necessarily being like the friend that we usually are, because it's consumed and sometimes it takes so much out of us that we're not able to like show up like we truly want to.
Mm-hmm.
Yeah.
So,
Yes.
may I ask a question? I'm so sorry.
Yes, ma'am.
So Rachel, when you say that like something that you become more aware of this year is the impact that your journey has had on some of your friends, how did you become aware of it? Did they feel comfortable bringing that to you? Are you finding yourself more in the role of like supporting them or encouraging them or telling them like, my journey may not be your journey? Like how did you become aware of it, I guess?
Yeah, I became aware of it because I had another trauma this year. Unfortunately, it's been crazy. I had 2 brain surgeries this year, and I was talking to 2 of my friends who are a couple, and we were talking about relationships, and like romantic relationships, and we're just having just an open discussion about marriage, versus being single and co-parenting, things like that. And how I feel like it's much easier to be a co-parent than like an active co-parent than it is to be married, because women typically do way more than their husbands when it comes to children. And we got on the topic of them not having a child, and one of my friends just started crying. She was like, you just had the brain surgery. We didn't know if you were going to survive that. And that's something now we become fearful of because it's not something that you anticipated having, or like that was even on our like bingo card for 2025. But it just reminds me like just how I had to advocate for myself in the hospital again with my brain surgery and speak the nurse jargon and beg for surgery. It put us in a mindset of how I was during pregnancy, where I was like begging for surgery, begging for the things that I need, and advocating and speaking the language. And she was just saying that, those situations, those pregnancies, like was really traumatic. She said we were right there with you, and they were. Like when that baby fell in the toilet, all my friends were there, throwing me a party, you know, because we thought it was safe. So it was just something that kind of came up. It wasn't something I even asked about or even remotely thought of, to be honest.
Do you mind telling us sharing a little bit about what you're doing now, as a result of, the unfortunate story that you've had to live?
Yeah, absolutely. So now, since then, I took like a year and a half hiatus from pregnancy. Actually, I took a permanent one from that, but I also just took some time to like relax, enjoy my baby, like bond and be intentional, like I said, about being a mom. And I started a nonprofit called A Light After Nine, and we help moms in their village navigate difficult pregnancy journeys. We equip them with the tools, the education, the empowerment, just so they can face this journey and be able to advocate for themselves. That was very important to me. A lot of the programs that we have are things that I wish I had. We have a Dear Mama and Dear Daddy series where we do guided journaling. I wish I had that to sit down and pause throughout my journey and really think about what is going on and process these emotions and feelings. We just had a Healing Forward program where we had a lawyer, an employment lawyer, we had a corporate doula, we had a psychologist came and talked to our moms in their village about just their rights. What are the rights with loss and stillbirth? There's a lot of people that don't know about all of these rights with the Disability Act, accommodations that they are entitled to, different things like that. Do you have to take bereavement leave versus short-term disability? What does that look like? Do you have to use PTO? Just clearing up those things so they can have these conversations even with their employers empowered. We have an upcoming event called Afterbirth, Where is My Village, which is about how to navigate conversations with your village, especially throughout loss. A lot of times people, your village are just like, oh my God, I don't know what to do. I don't know what to say. I don't know how to help. So sometimes we have to be the ones to navigate that. We're also teaching the village how to approach you, how to just show up for you, how to help you navigate that conversation. We have our first in-person event on October 4th at the Auburn Research Library called Dear Mama. And it's called Dear Mama, Your Story Matters. So if you're feeling like you're in a space to hear the stories of others, like we're doing today, or sharing your story, which could save a life, literally, this is like the perfect place for you. We're also having guided journaling. We're having food. It's all free. It's for everybody, just so we can create a safe space throughout this journey. Because, like I said earlier, this burden, this load is just a lot to carry along.
Yeah, that is wonderful. I love that. So you said this is your first in-person event. So have you been doing online events leading up
Yes.
to
Yeah, we do a host of online events. I would say my favorite is the Dear Mama, and now we're incorporating Dear Daddy because a lot of times dads are just in the room lacking the knowledge. Healthcare providers completely ignore them. Like, they are going through this too. They might not physically go through the loss or physically go through the pregnancy, but they are helpmate during this time. They can be the one to speak up when we are not able to. They can be the one who are also experiencing depressive symptoms and anxiety related to losses and uncertainty, and have these emotions pent up and bottled up. When we're on the airplane and something's wrong, the first thing they tell you to do is put your mask on because you can't save other people without you being okay. So we can't expect dads to step up for moms in their times of need if their mental health is not okay, you know. And like I said, it does unfortunately get the best of our relationships and marriages. So if we can avoid that by giving them a safe space and a platform to speak up as well, and to journal their feelings and just to get it out, that's what we're gonna do.
I love that. How can people find you in all of the wonderful things that you're doing?
Yeah, so we're at A Light After Nine on social media, all our social media. We also have a website, alightafternine.org, and you can email me at info@alightafternine if or fill out the slip on our website if you need specific assistance, like finding doctors. We vet them too, or if you need mental health resources, if you're going through fertility challenges and you need fertility resources, there are grants that a lot of people don't even know about. That is expensive. So I'm not sure how people are affording that unless you have like some type of like employee benefit. And even then it's still expensive, but we help with all of those things.
That's wonderful. I know of some, I mean, you are a nurse, and I know even being a nurse, you know, you shared the impact that the negative impact of a lot of healthcare providers. And I know of some healthcare providers here in town who weren't able to make the call, but might come back and listen to the recording. Like, do you have a message, you know, like what message would you share to healthcare providers who are providing the, you know, the maternal care through pregnancies and even following? What's something that you wish from your heart you could share?
Yeah, that these are some of the most vulnerable moments, and pregnancy is one of the most life-threatening moments a woman could experience. Your language matters in their story, your actions matter, and how you receive their attempts at advocacy and how you advocate for patients can make the difference between life and death for that patient. It can also be the difference between life and death for a baby. So when you're going into that room, check yourself. Like, remind yourself why you're doing this. And treat that patient, I would say as a family member, but treat that patient like you would want to be treated, with dignity, with respect, you know, with compassion. You know, there's a lot going on when you're pregnant, a lot, mentally, physically, emotionally, spirit, in every way. Please, please, please do not be in adversity to these patients and their village.
I love that. Is there anything else that you would like to share?
Well, thank you for having me, and the work that you guys do is just amazing, and for having a safe space for people to talk. I had to stop myself from getting emotional a few times, but but I just love spaces like this where we're able to be emotional and vulnerable and explore those feelings, because it's hard to do that while you're walking through this journey that you don't know how long you're going to be on. You just don't know. And spaces like this matter so much. And whether somebody is here today or watching a recording, it truly impacts our lives in a positive way. So thank you.
Yeah, thank you.
I'm going to unrecord now. Thank you. I appreciate you being here today.
Yeah.